Loop 1. It was the noise that started me out of my sweet dream. I bounced up abruptly from facing down on the table to sitting upright. My eyes shifted frantically from left to right. In the blink of an eye, I wondered where I was. Dr. Tin! Someone's voice calling out made my head turn around. Aim, a young female nurse, was standing with two hands grabbing firmly onto the table, and I realized where the noise came from. She must have smacked the table to wake me. How could you fall asleep? Many more cases keep on coming in like it's a battlefield outside. Hurry and go help your juniors, please. Really? I'm sorry. My back bent over to pick up my beloved black limited edition stethoscope, which I was unaware of when it fell from my neck. I just wanted to come grab a bite for like 10 seconds and go back. I didn't think I'd fall asleep. Aim glanced over the food on my dish, which had almost not been touched, and sighed. Oh dear, you even fell asleep while eating. Are you sick, Dr. Tin? Would you like to take a leave? I stood up and hung the stethoscope around my neck. Even if I'm sick, have a fever, diarrhea, faint, or get hit by a truck, I cannot leave unless I'm dead. I turned to Aim, who was standing with her arms crossed. And even if I was, I'd have to do CPR on my own, rescuing myself to continue with my duty. CPR, or cardiopulmonary resuscitation, is a method to keep someone alive in a medical emergency, in which you blow into the person's mouth, then press on their chest, and then repeat the process. Aim chuckled. Doc, you're hilarious. Hurry and go. I gave her a salute, swiftly turned around, and walked out of this small dining room beside the ER. ER means emergency room. I lifted my hand and stroked my currently disheveled hair, which I had not been paying attention to for quite some time. My life these days could be the most complete and utter disaster of my entire existence. I pulled on an all-nighter for a case conference that received nothing but harsh criticism from professors and carried on for morning and afternoon shifts in a row. Did I choose the right path to advance my degree in emergency medicine? But when I became aware, I was already a senior resident in my last year. In next to no time, I could return to a hospital in my hometown. The first view my eyes perceived after stepping into the emergency room's territory was a tumult resembling a civil war. An elderly male patient was being carried on a gurney, passing in front of my eyes. Gap and Pin, the first year and second year residents, were hectically jumping from bed to bed. Two externs were not different, one rushing to take in the recent case that was just carted away right before my eyes, and the other turned to look at me. His expression was as if he saw a god. Pitin! One screamed. He is a common Thai honorific to address someone older than you, regardless of gender or age difference. It implies that you respect him or her as a brother or a sister, pronounced as P. Help me, please! I quickly approached him while he was examining a middle-aged man whose breathing did not look proper. One was an extern assigned to the ER for only a few days. His encounters with crisis were limited. Besides, it's my responsibility to guide and advise all individuals on duty. Tell me about the case. Male, 52 with asthma, takes bronchodilators and uses inhalers. Bronchodilator is a substance that helps dilate the bronchi and bronchioles, which will increase airflows in the lungs due to decreasing resistance in the airway. He felt extremely exhausted for 30 minutes before coming to the hospital. The first vital signs showed a rapid heartbeat. Oxygen sat at 94%. I heard wheezing in both lungs, so I administered a breathing treatment. 3 doses have already been administered. He's still tired, but the oxygen looks fine. It does, but his breathing doesn't. I took my stethoscope to listen to his lungs, hearing a resonant sound of wheezing in both. His heart was racing so rapidly. Uncle, You're using your abdominal muscles to breathe. Uncle is a title commonly addressed to older men in middle age respectfully, even though they're unrelated. It's a sign of breathing failure. Even though your oxygen level seems normal, you remain exhausted. We need to insert a breathing tube to help you, I explained to him. He nodded in acknowledgement as he was way too tired to let any words out. Intubate! Tube number 7.5 in volume, please. Valium is a medicine by injection used to induce drowsiness prior to surgery. Diazepam. Tube number 7.5 in volume. One nurse responded and sprinted to a medical trolley. A nursing assistant reached out to get a mask and an ambu bag ready, then skillfully hooked them up to a source of oxygen. Juan, go ahead. You've done it before, right? I looked at Juan, rushing to stand by the patient's head. Yes. He covered the oxygen mask on the patient. But can you stay with me first? I'm afraid I can't do it. All right, I'm here. My eyes wandered around to monitor if there were still any concerning cases. Once it's done here, I was going to go around on every bed for any potential patient that could be discharged from the ER. As soon as the effect of Valium began, one positioned the patient conveniently for a precise airway examination. He slowly inserted a sickle-like tool called the blade into the patient's mouth and lifted it. Looking good, bro. You must have previous experience with intubation. Then there's nothing to be concerned about. Almost over half a minute had passed. There was no end in sight to one's insertion. Can you see it? I questioned. His arm holding the blade trembled. I can't see anything at all. My eyes spotted massive dripping sweat from the extern lad's forehead. Seconds later, a low oxygen warning sound was emitted from the EKG monitor loudly. EKG means an electrocardiogram, ECG or EKG. The patient's oxygen saturation gradually decreased from around 90 to 80 and then to 70 in order. Hey, squeeze the ambu bag first. I immediately ordered the extern to help the patient's aspiration by squeezing the balloon as the situation was getting out of control. I give you one more chance. If you still struggle, I'll do it. One removed the blade from the patient's mouth, raised his arm to wipe off the dampness on his forehead, then put the oxygen mask on the patient's mouth and nose. Accident patient, unconscious! I shouted through all the staff's attention in the ER, noticing a group of people speedily accompanying the gurney. I could tell right away it was an accidental case. A young male patient was transported to a solid orange board with belts, having a hard cervical collar placed around his neck, and a splint on his right leg for first aid. My eyes switched between two cases, the asthma and the accident. At least I felt relieved after seeing Nong Pin, the second-year resident urgently attended to the arriving case. Nong is a common title given to someone younger than you, regardless of gender or age difference. It can also imply that you adore them like your own siblings. Juan, help Pipin over there. I'll do the intubation. I chased Juan to look after the accident patient, and I should hurriedly finish this to go support them. The young man was likely to lose consciousness by now, but should not be as severe as having his heart stop beating. I put on gloves and swapped places with Juan. As soon as Uncle's blood oxygen level went up to over 90 because of my CPR, I moved him so I could put the breathing tube in. Damn, it literally can't be seen. This is difficult. Cardiac arrest! Finn shouted so loudly that I had to look up. Cardiac arrest is a condition where a person's heart suddenly stops beating. The accident patient's heart stopped beating. I wished to go over, but I couldn't just leave this case. Nong Pin was also capable. I was confident that she knew how to handle and rescue the patient. I had wasted plenty of time on Uncle's case, but a physician with God's hands like me never makes a mistake. Despite the difficulty, I eventually intubated on my second attempt. Once I connected the tube to the ventilator, I immediately phoned a resident on duty in the ICU to take care of the case. Uncle was now in stable condition and was about to proceed to the other room. So I rushed forward to the accident case that had just arrived. We had already put a breathing tube into the young patient. His heart rate returned to normal. His blood pressure was quite low. Nong Pin reported to me. She was my junior, 1 year younger. Her usual appearance looked much more attractive than how she looked right now. But the damage of today's cases loosened her tied up long hair messily and left her with a super oily face. A 22-year-old patient fell off a motorcycle unconscious when EMT arrived. EMT is an emergency medical technician. His vital signs were good at first, only a racing heart. While I was checking up on him, his pulse was gone. The EKG changed to PA. PA means pulseless electrical activity. Pumped 2 cycles and his pulse returned. He's still young. What could be the reason here? I stared at the EKG monitor thoughtfully. I presume because of the massive blood loss, there's no bleeding on external organs except for his broken right thigh bone. His pelvis looked fine. Both lungs sounded equal. So possibly internal bleeding in his abdomen cavity. I'm going to perform an ultrasound scan. Okay, do it. Don't forget to follow up on the blood. Do EKG and have an extern call surgery. If his family members come to visit, please notify me. I'll talk to them. Yes, Pin nodded and turned to converse with one. It reassured me that Pin could take care of the case, so I began my round on other patients in better conditions. I would discharge to their homes those who had recovered and write a medical order for those who needed admission. I would send the admitted patients to the ward, where the staff probably cursed at me, as I had been passing a tremendous number of patients carelessly. No pulse again! Nong Wan shouted menacingly while I was consulting a professor of medicine for some prescription advice on the phone. Nong Pain ran over there, making me feel at ease, so I stayed in the conversation and was going to help them as soon as the call was over. 30 minutes had passed. The case ended with the sound of the patient's parents crying. Two nurses helped clean bloodstains on the body and removed all the equipment, the breathing tube, the IV, and the others connected to monitors. Because of the cardiac arrest state, we couldn't either do a CT scan or an operation, so I did not know which part of his body was injured. I'd probably recognize it once the autopsy results came out. My eyes gazed at the lifeless body with the feeling of having a hole in my chest. I guessed the patient was just an undergraduate. He had an attractive face with fair skin and a healthy shape, and was most likely to be popular at his faculty. He could have become the future of our nation, the hope of his family, but had to pass away so soon because of a motorcycle accident. I took a deep breath out to get rid of my tiredness before turning around and running out of here to a recent case. This kind of circumstance was what I had been experiencing every day until I became accustomed to it. Failing to save a patient's life with fatal threats. I needed to move on as if nothing had happened. So knackered! I yelled in the dining room, stretching my arms until my belly popped out. Gap, the first-year resident, drew my shirt on, shielding me from the public eye. Our uniform had a top and pants in the shade of blue, with the hospital's logo stitched on the left chest. Having a uniform to change during working hours protected my apparel from all kinds of bodily fluids that spurted all over the ER, which is something typical. Stop showing off your six-pack and sit down, Hia. Hia is another common Thai honorific to address a person older than you, regardless of gender or age gap. It implies that you respect him or her as a brother or sister, pronounced as Hia. Look, I feel my legs have shattered into pieces. What a crazy shift! Freaking chaos! I took a quick look at my watch, showing that it was already half past midnight. I slumped back in the chair next to Gap, exhausted. Stop it. I've been working double shifts from dawn to dusk. You'd better look at me. The morning shift started from 8 a.m. to 4 p.m., and the afternoon shift was from 4 p.m. to midnight. I guessed I would wake up again tomorrow evening for sure. I yawned once more, putting my head on the dining table, then drove back to my condominium close to the hospital, but wasn't sure if I had any energy left to do so. So, do you know the cause of death in that case? Mon said. My perception was the bleeding in the abdomen cavity. I noticed some bruises on the right side of his stomach. I pressed around and found that his lower abdomen was quite hard, Bean stated in a thoughtful tone. His condition was always bad, so I couldn't let him have a laparotomy. Laparotomy is a type of surgical procedure on a person's abdomen. Whoa, I didn't check that case at all. I was fully occupied with a grandma patient suffering from septicemia. Septicemia is a bloodstream infection. It took so long to pump her heart. My eyes are so heavy now. I gotta go back to my dorm first, yeah. I felt a pat on my arm, followed by the sound of a chair sliding. I'm leaving too, Pin said. See you later, P-Teen. Okay, I replied, despite facing down on the table. I guess I should take a nap before driving home. Otherwise, I might end up being a case for the night shift myself. As my brain was shutting down, the deceased young male accident patient's face flashed into my mind. I was still deeply moved when I thought about it. Anyway, he wasn't the first young man I couldn't save. Once everyone left the room, my mind instantly fell into a deep slumber. End of loop 1.